Good morning, everyone. My name is Carla Compton. I'm the MLA for Tuxedo, and I'm also a registered nurse. Before we begin, I'd like to honor the sacredness and importance of this land and of the ancestors that once walked where we are standing today. The Anishinaabe, the Inanawak, the Dene, the Dakota, the Inuit, the Anishinaabe Nations, and the Red River Métis, all who paved the way for what is now known as Manitoba, home to all treaty people. And the reason we share this information with you is that it's a reminder of our treaty histories and the original homelands of all those nations, which have become home to all of us here today. And I would just add too that as a healthcare provider and to these fresh minds that are learning and entering into our healthcare system, it is so important that we remember and we know our history because we want to be the best healthcare providers possible. So welcome and thank you for being here. Today's announcement highlights the next steps in rebuilding our healthcare system by expanding and accelerating paramedic training. This includes new opportunities at Red River College and important progress for advanced care paramedics in rural Manitoba. You'll hear more about these initiatives from our speakers shortly. So to begin our program, please join me in welcoming the Premier of Manitoba, the Honourable Wab Kinew.
Thanks, Carl. Good morning, everybody. Thanks for joining us. Today is all about adding more paramedics here in Manitoba. Today we're really happy to announce that we are launching a new direct entry program here at RRC Polytech. But most importantly, look around this room. Look at all these great paramedics in training. I just want to say congratulations. Thank you so much for choosing a career, a calling, to help our communities here in Manitoba. And on behalf of your provincial government, please stay in the province for many, many years to come. Making sure that there's more paramedics is about responding to the needs of seniors in the community, of folks in our families when we have those unexpected emergencies, but it's also about having a good quality of life. When we want people in Winnipeg, people in rural Manitoba to be able to put roots down here and to call this place home, to build up that bright future that we all want, part of that means having the health care there for you when you need it. And that's what these paramedics in training are going to be doing. And direct entry, to me, it's just such an exciting opportunity that somebody can go straight from high school, that somebody, wherever they're at in life, whatever they're coming out of, is going to be able to step up, put up their hand and say, I want to be a paramedic. I want to be one of the helpers in our community. And that our education system, led by leadership, like here at RRC Polytech, is going to say, great, let's talk about how we make that happen. As part of this announcement today, we're also committing to expanded training seats at the University College of the North, because we know that rural and northern healthcare and paramedic needs are really, really important. And this is one of the crucial ways where we will cut down on EMS response times for folks living outside of the perimeter. So there's been a ton of great healthcare news this week. We're going to be ending mandatory overtime. We're bringing in a patient safety charter. We're going to be legislating staff to patient ratios in particular priority aspects of the healthcare system. But so many times the first person that somebody interacts with on their journey of healthcare, it's with the paramedic. And so we want to treat you all right, and we want to say more than anything, thank you for stepping up to help our province. Miigwech merci, thank you very much.
So thank you, Premier, for those remarks and for your commitment to rebuilding our healthcare system. And it's now my pleasure to invite Rebecca Clifton, speaking today on behalf of the Paramedics Association.
I don't think I can echo Wab's comments anymore. It is so refreshing to see an entire room filled with paramedics that might be at the beginning stages of their education, the middle, and you're going to continue learning all the way through your career as a paramedic. And the Paramedic Association is pleased to see more primary care direct entry opportunities available to Manitobans. Just a short 17 years ago, I graduated from small town rural Manitoba High School with no idea of what I wanted to be when I grew up. Paramedics weren't at the forefront of everybody's minds. We didn't have groups like Shared Health, like the government, like Red River going around promoting the paramedic profession. We were always just a little bit hidden and not really the more popular first responder. And so I tried a couple of university courses and absolutely hated it. And then I walked right into the paramedic program at Red River College when it was brand new at the time. That decision changed my life, but it also opened the door to a career that was not only meaningful and challenging, and I could get into it with a path forward, but it paid well, and it's truly a rewarding career. A lot has changed in 17 years. We've had some ups and downs, but the paramedics coming into the workforce today are incredibly well-educated practitioners. The government has worked hard in these last 2 years to break down these barriers to entry. We know Manitoba needs more paramedics, that's not a secret, and we couldn't be happier to see full classes across this province and all hands on deck to make that happen. This will allow students, just like me, to start planning what they're going to be taking in high school, the courses they're going to take to allow them to step directly into paramedicine without delays. It strengthens our profession by attracting young, talented individuals earlier, allowing them to become leaders in the profession, educators, critical thinkers, and skilled clinicians. They have an opportunity to advance in this profession, to make this a career that's going to last a lifetime. Thanks to this government, we are finally seeing real-life advanced care paramedics practicing on ambulances in rural Manitoba, and this is something we personally have advocated for decades, and I don't think I can emphasize how much of a historic moment this truly is. There is more opportunity now more than ever. All of these changes ensure that the next generation of paramedics are ready to serve their communities, to serve and care for Manitobans with skill, compassion, and purpose. And I know that every single paramedic who is out there working right now cannot wait to welcome every single one of these graduates with open arms into the profession, into the ambulance, and into the career. So thank you.
Thank you, Rebecca, for your remarks and for your work and what you and your members do every day. Next, I'd like to welcome Fred Meyer, President and CEO of RRC Polytech, to speak.
Anin Bushu Tanze. Good morning, everyone. Thank you for being here and making the time. Welcome to RRC Polytech's Interdisciplinary Health and Community Services Center, one of the newest spaces at our Notre Dame campus. I want to welcome Premier Kinew for joining us today and making the announcement today. And we are extremely proud to be in partnership with the province of Manitoba to make this happen as well. I want to welcome Minister Asagwara and Minister Cable here as well. Thank you for joining us. Just a little bit on those two departments. We work very closely with those two departments on making changes to our programs to meet the needs of Manitobans. I also want to welcome Carla. Thank you for starting us off in the right way with a land acknowledgement as well. And thank you, Rebecca, for those comments to really hit home. To hear about somebody's own personal journey is always something that is impactful for us here at RC Polytech, but also for the students who are in the room here today. So as I was reflecting on what I wanted to say today, it's exactly 1 year ago yesterday that we opened the doors to the interdisciplinary center that you're standing in today. I also want to recognize and thank the students that are here today from year 1 and year 2 of primary care paramedicine program. I had an interesting interaction on my way in from the parking lot today. One of the students that's here today we bumped into each other and had a quick chat about what was happening today, and I was talking about the exciting announcement, and they were only focused on one thing, which was the quiz that happened right before we walked in here. So we know they're focused on the right things, which is their learning journey. So great to see everybody here as well. The students that are joining us here today and the spaces that they're learning in represent the future of healthcare and Manitoba's healthcare workforce. One that we continue to build stronger together, because RRC Polytech graduates are equipped not only with the knowledge and the skills they gain from training in modern facilities, with opportunities for interdisciplinary collaboration and experiential learning, but equally important is the cultural diverse knowledge and understanding of delivering safe and inclusive, patient-centered care in our communities. One of the largest trainers of healthcare professionals in the province, we play a pivotal role in ensuring that students are gaining the skills, the competencies, and the confidence they need to make an impact in our communities. And we are incredibly proud of the work we do here, and we know it makes a difference in the lives of Manitobans every day. We're also committed to ensuring that we can support even more students who want to pursue careers in healthcare. It's why we continue to work with our partners in government and community to look at ways we can remove barriers to accessing training opportunities. Whether it's updating the entry process for students directly from high school into programs like the Medical Radiological Technology program or the Primary Care Paramedicine program like we did this fall. Or delivering more training in community through our regional campuses or our mobile training labs. This approach to delivering education in community creates new, effective pathways for learners to build meaningful careers without having to leave their homes and their support networks. For example, the healthcare aid training program that is currently being offered in Roseau River Anishinaabe First Nation, or expanding programs like our Pathway to Health program for Indigenous learners. Pathways are preparatory and exploratory programs that help ensure students have the skills and the support they need to confidently transition into specific RRC Polytech health programs. They also provide Indigenous learners with opportunities for reserved seats in healthcare programs like the primary care, paramedicine, or nursing programs. And one of the things about the Pathway program is that it started with a cohort of 24 students, but because of the strong demand, we tripled that program, and now there are 72 seats, and the program is completely full. Our greatest strength is the agility and ability to be responsive and put forth innovative solutions to help address Manitoba's greatest training needs and in healthcare and beyond. And it takes great courage and resilience and compassion to pursue a career in healthcare. I want to thank all the students who are here today with us and who were called to this career path to care for others. Thank you so much. We continue to work alongside our partners in industry and government to anticipate what is needed, not only today, but tomorrow, and to ensure more students have access to training opportunities and supports here at RRC Polytech, so when they enter the workforce, they can do so with the confidence, knowing they have had a solid foundation of skills behind them and they're ready to make an immediate difference. Thank you so much for being here today. Miigwech.
Thank you, Mr. Meyer, for your remarks and your continued leadership. So that concludes our formal program for today. I want to thank all of our speakers and everyone who has joined us. And so we'll now open the floor for questions from the media.
Sure, so we've got a new direct entry pathway that is officially launched. We've got actually, I believe, 18 direct entry pathway learners here today. I want to shout those folks out. Thanks for choosing that. And just, announcing that we're adding capacity. We've added new seats, we've added a new pathway, and we're going to continue to add capacity, including in the north, UCN, and in Thompson. We've got 32 seats, UCN and the PAW, 16 and 16.
Describe what direct entry exactly means. I know that might sound like an obvious or a silly question, but just...
Sure, maybe I'd ask my colleague to speak to that.
Sure. Direct entry means that the curricula has been augmented a little bit so that courses like anatomy and physiology are included in the curricula rather than having folks need to go to university or to another learning institution in advance with those credentials. So it really allows people to find their way in faster. Actively working in a number of other programs as well to do similar or same things to make the transition easier and put fewer barriers up for students.
And then the 14 seats that we're announcing today and the 16 that are at UCS, are those net new seats? These are new seats at both facilities that have never existed before?
Correct.
Okay.
For the ones in the north, is it brand new? Like what would be non-direct entry seats that would actually or
So there are, as folks know, there are unique challenges in the north on a whole. One of the things that we recognized very early that was that we need to break down as many barriers as possible for entry. So the program in the north is direct entry only.
now for the ones here at Red River, there are not, it's probably been business before, there was not direct entry, so are we going to gradually change those to all direct entry?
That's the plan. Yes. So we have people in process already that did not kind of take the fast road, but now everybody will have the same opportunity to enter and continue on their studies with that direct entry.
We're hiring advanced care paramedics in rural Manitoba for the first time in years. So we've got seats for the first time ever. Thank you, ever. Yeah. You know, and I want to highlight something that Rebecca said, which is really important. Folks have been advocating for that for many, many years. Many years. And, you know, it's something that our government knew coming into office that we needed to take action on very, very quickly. We've got a number of advanced care paramedics now working in rural Manitoba, and we look forward, the Premier and I and Minister Cable, you know, we get a letter of offer in the hands of folks before they graduate. We look forward to making sure that these learners who want to pursue advanced care paramedicine jobs have those letters in their hands before they graduate, and they know exactly where they're going to be working before they get through their studies if they choose to.
So yeah, everybody heard that? We're hiring everybody. We're hiring everybody. You don't get the letter, come see us.
Yeah. Yes. We can get you that number.
And then maybe this is something we need to follow up on as well, but just wondering, do you know how many net new paramedics have been added to Manitoba since October 2023?
We can get you that number. We've got a number of folks. Obviously, we've now got ACPs working in rural Manitoba. We've got PCPs. We've done work to make sure that we've got emergency medical responders. We've got much more emergency medical response capacity now in rural Manitoba than we've had in many, many, many years, in some cases ever with ACPs. But we know there's much more work to do. You know, we're in a room today with a full class of paramedicine students. It's been a long time since we've had that happen here in Manitoba. We've got seats in the north. Like, we have more capacity to train people now than we've ever had. And there's more work we have to do. So we want to make sure, yes, this is a big moment, this is a big day, but we want for all of these folks in the room to be pumped about the jobs that they're going to be able to practice and have in Manitoba, and start telling their friends so that we have more folks who join the front lines and join this program across the province.
Is there a financial component that's going to Red River for it? Like, does Red River get any additional funding to open these seats, or how is the province kind of navigating that?
I'll probably have Minister Cable speak to that in a bit more detail. We've got a really strong partnership with Red River College. I have to say they have been incredibly responsive, a phenomenal partner to work with. And of course, post-secondary education is Minister Cable's responsibility, and they work with Red River to make sure they have the adequate resources to deliver these programs. But we work across departments in government. So we identify in health, what do we need in our healthcare system? How much more capacity do we need? Where do we need that capacity to be? And we work directly with Minister Cable and Red River and our partners to make that happen on the post-secondary level. Do you want to speak to dollars, or?
We can. So every program comes with a proposal from the post-secondary as to what it is going to cost to deliver a full cohort, and that is the funding allocated for it. We are in the process of doing our estimates for the next year. We can follow up with specific dollars for today, but that will continue to evolve with our continued conversations about the need for expansion on different programs.
We have over 3,500 net new healthcare workers in Manitoba. We have over 1,200 net new nurses working in Manitoba. We are hiring nurses every single day in this province. We are training more nurses and more healthcare workers than we ever have in our province's history right now in Manitoba. And that is something for us to be really proud of. We also know there's more work for us to do, including on the nursing front. So we're going to continue to hire. We do not want to lose any momentum. We want to continue to add as many nurses as possible to the front lines of our healthcare system. We recognize as a government that ending mandatory overtime, particularly as a staffing tool, needs to happen. And so we are going to be holding regional health authorities accountable to that. We're going to be working with them to ensure that they're taking a better approach. We've got the nurses in the healthcare system to do this, and we're going to keep hiring as many nurses as possible, including welcoming nurses from other jurisdictions to our province, from the United States, internationally educated nurses. There are many folks now who are looking at Manitoba as their top choice, not a flyover province, because our government is taking these steps. Yes, and this is an important step for us to take. We've heard from nurses for many years that they want to see this action taken. It's a step that our government needs to take, and we're going to continue to hire as many nurses as we possibly can and welcome nurses to our province so that we can end the practice of mandatory overtime. I'm a nurse myself. I worked on the front lines for years. I know the impacts of working mandatory overtime. The Premier has said it previously. We've said it really well, I think, already. Manitobans should trust that when they're showing up to access health care, that they're getting the care from a nurse who hasn't been mandated to work back-to-back, in some cases to back shifts. And nurses deserve to know that they can go to work, have a good work-life balance, and go back home to their families and have the quality of life with their work that they've been asking for. So it's an important step that we're taking. We're going to keep hiring nurses to make sure that we move in the right direction. Well, we've taken a number of steps. We know that the data that was released recently on that in terms of nurses leaving the workforce and young nurses, that was data that was actually gathered under the previous government, right? So under the previous PC administration, yeah, we saw a lot of nurses leaving the workforce. We weren't hiring net new healthcare workers or nurses in Manitoba. We are hiring net new nurses to the front lines of our province, and that's really important. Ways we've been able to see that change happen, making sure that we're collectively bargaining agreements. You know, all the paramedics in the room here today have a collectively, paramedic students, you'll be paramedics soon enough, have a collectively bargained agreement in place so they can have good paying jobs with benefits, incentives in place. For almost 6 years, paramedics in this province didn't have an agreement. Their wages were frozen, which was totally unacceptable. And we saw a loss of 90 paramedics in rural Manitoba as a result. So as a government, making sure that we are treating workers, healthcare workers fairly, making sure they have bargained agreements, making sure that they've got a better work-life balance, making sure that they have respect in the workplace, adding folks to the front lines, making sure that we're listening and showing up to their workplaces as we've been doing as a government and will continue to do, to not only hear their concerns, but to action their solutions. So all of the steps that we've been taking, we're seeing that pay off with net new nurses being in our healthcare system. But again, there's no end date to this. There's no finish line. This work has to continue. We're going to continue to make workplaces safer and more secure for nurses and paramedics and healthcare workers across the board so that we can continue to see that trend of net new healthcare workers across our province.
Back on paramedics, the union says that the campaign of just one paramedic so far in 2021. We are graduating dozens each year. What's going on?
Look at the room that we're in right now. We've got a full class for the first time in a long time here in Manitoba. The work to turn around the damage done to healthcare, including losing almost 100 paramedics alone in rural Manitoba, doesn't get fixed overnight. It takes time, it takes teamwork, it takes sustained effort, And that's what you see. You see partnerships across this province, government, Red River, Paramedics Association, shared health, organizations that are working together to make sure that paramedics have what they deserve to have in work-life balance, in agreements, in incentives, in packages, and support in communities and mentorship so they can be successful when they work those jobs across the province. So we are moving in the right direction, but it takes time to fix the magnitude of damage that was done. And as the Premier said, we can't thank these folks enough for choosing this calling. Working in healthcare is a calling. It's an incredibly rewarding profession. It takes special people to choose that path. And I'm absolutely thrilled that we've got a room full of paramedicine learners who are going to be working across Manitoba, including many of which in this room in rural Manitoba, sooner than later.
Maybe just switching gears here, just a quick one for Premier Kinew. Can you let us know when can we expect to hear updates about the plans for the safe consumption site? When will the location be released?
So just a note on language, we say supervised consumption site, and the reason why we say supervised consumption site is we want to be realistic about what's happening in this facility, and we also just want to make it clear that we're talking about a healthcare service here. Supervision, meaning a nurse or a nurse practitioner or somebody else with some great training like the people that we're here in the room with today who can talk to somebody about maybe making that change towards recovery, or get tested for pregnancy so that we can stop syphilis and HIV being passed on to babies as they're born in Manitoba, or even just getting a primary care appointment so that somebody's lingering healthcare issue can get addressed. Maybe we're not going to get somebody to turn their life around 180 degrees overnight, but maybe we could start to put them on a more positive path by tying them into primary healthcare. That's what we mean when we say supervised. Just to say a supervised consumption site is going to be about tying somebody in to healthcare. You know, in terms of our legwork on this, we are pretty much ready to go. We've got to do a process with the federal government to get approval because it is a serious step that we're talking about here. We anticipate January, and you know, that application will be submitted like in the coming days or weeks, and you'll see the details there when it gets submitted. Yeah.
And then in terms of those community consultations and notifying folks so they can be part of those, when will that take place, and how does the government?
Yeah, within the same time period. I mean, we've done a ton of consultation about this already. I think it's no secret. You guys do a great job of helping us get the word out every time there's some news on supervised consumption. And so we'll have those next steps of community consultation, the submission to the federal. Yeah, between now and the end of the year. Yeah.
I wonder if there's some reluctance to say where this is going to be concretely, you know, just given what happened last time when the community pushed back.
Well, look, drive down Main Street. Tell me, what do you see? That's the alternative to having a supervised consumption site. It's not like, do you agree with a supervised consumption site like out in some like utopia there? No, like the alternative to a supervised consumption site is unsupervised consumption site on Main Street, in the bus shelter, in the bathroom at Tim Hortons. I think we all agree we got to do better than what we're seeing right now. And so again, we've been flexible and we've been listening. We've changed the location based on community feedback. I think that's an act of good faith. But at the end of the day, the doctors, the experts, the healthcare professionals with an expertise in addictions medicine say, you know, you're doing enforcement, you're doing prevention, you're doing recovery and treatment, but here's one additional harm reduction tool that you can add to the arsenal. And when we're talking about life and death, we're talking about overdoses, we're talking about babies being born with preventable disease. Like a baby in a rich country like Canada should never be born with HIV. That is entirely preventable. Same thing with syphilis. And yet it's happening in our province. And it's a recent phenomenon. It only started happening within the past decade, and it's because of IV drug use. So again, I understand that people like hear supervised consumption and they're like, I don't know if that's right. But the thing is, it doesn't happen in a vacuum. You have to understand that the reason Manitoba is about to open a supervised consumption site is because we have babies being born with HIV right now in a way that didn't happen before. We have people who are overdosing in public places or in people's basements at private homes in a way that far outstrips what the numbers were historically. There's been a little bit of an improvement in the trend, but it's still much higher than the historical average. So again, you know, not to put too light of a spin on this concluding comment, but this is why I say it's like Buckley's cough syrup. It tastes awful and it works, right? So I'm not asking you to like it a supervised consumption site. I'm just asking you to understand that this is a public health emergency that we're responding to, and it's one of the tools, not a silver bullet. It's one of the tools that will help.
Thank you.
Yeah, no, thank you.
Climate action in Manitoba considers considering the announcement of power generation facility plans on 50 roads to get us to net zero by 2050. How does the turbine facility fit within that path to net zero?
Is this?
A quick fix.
Well, the net zero is a deep conviction of our government. We want to do right by the climate. We also have this guy to the south of us with the spray tan and you know, all sorts of terrible nicknames for reporters that is trying to damage our economy. Building these turbines is part of Trump-proofing our economy. What have we got to do to insulate Manitoba from the impact of the Trump tariffs? One is we need to put people to work. So we're offering a job to all these paramedics. We're also going to invest in $3 billion worth of construction behind this new energy plant. So all the people in other parts of the campus here who are getting their trades, who are working towards their red seals, this is how we're going to put you to work. And this is in rural Manitoba. This is just outside of Brandon. So this is a big province-wide economic development incentive. And then power. The coldest days of the year, when they come in January, we import power from the U.S. right now. Given what Mr. Trump has done, we can't count on that. We shouldn't rely on that. We have to be independent. We have to be independent when it comes to our money. We've got to be independent when it comes to our power, too. And this energy plant will help us do this. At the same time, when you think about the environment, it's going to start with natural gas, but we can convert that to renewable methane. We can convert that to hydrogen in the future. So the idea is let's build up our economy now, and then we're going to use technology to make sure that we hit the goals on the environment, and we'll hit that net zero target by 2035 when it comes to our power grid. Yeah, I'd love to do it tomorrow, but the reality is we don't have a hydrogen industry in Manitoba or Canada, so we got to see the business step up there. And then with renewable methane, there is actually a proponent in the Brandon area working on that right now, so that could potentially happen in the 3 to 5 year timeline. So yeah, it's really, really important. When people from the environmental movement raise the concerns, I hear you. But the reality is no one's given up their phones. No one's given up their cars. No one's going to accept a freezing home on the coldest day in January and February. So this is what we're doing to keep the lights on and to keep the furnaces running. And at the same time, absolutely, we'll work with you to make sure we have a safe, clean, healthy environment for the future generations.
Well, you know, our government has always been very, very clear. We stand with trans communities, we stand with trans kids, and we'll continue to do just that. You know, our government's also brought forward legislation addressing the notwithstanding, and I think we've also been very, very clear that protecting human rights is something that is a value of Manitobans that we're going to continue to uphold. So, you know, it's difficult to see trans youth and their families struggling under conditions that, you know, you think we'd be well past by now. But, you know, this week in particular, it's so important for us as a province to celebrate the fact that we're led by a premier and we have a government that stands with trans communities and supports families who are navigating gender diversity as part of their journey. And, you know, I had the privilege to sit down with a doctor from the United States who has relocated to Manitoba in the last 3 weeks. This is a trans physician who loves our province, who is thrilled to be providing care to Manitobans, and is grateful to have a place that they can call home, know that they're safe and respected by their now government. And so, Manitoba, I think, has an opportunity. We as a government have the opportunity to continue to be led in a good way. The Premier sets a phenomenal example for the rest of the country in terms of how we stand with communities who deserve to have their human rights protected. So in this week in particular, I think it's really important for Manitobans to continue to be focused on being unified, standing up for human rights, and celebrating what makes us strong as a province, and that is our diversity, and that includes our gender diversity. I definitely defer to the Premier
No,
on
it'll be
that.
reintroduced. Yeah.
We'll go to Zoom now.
Thank you, Minister. We have one outlet on Zoom today, Brandon Sun. Tessa, one question, one follow-up. Go ahead.
Thank you so much. I have a question for Rebecca Clifton. Rebecca, you said that Manitoba needs more paramedics, and that's no secret. And I'm just wondering, can you describe that need as it relates to the Brandon and Westman area, please?
So I think this government has been very transparent with the number of vacancies that exist. They've been very collaborative, talking with a variety of municipalities and elected representatives out there, as well as the communities. We know that the minister was just out in that entire area within those facilities talking to those groups. There is a substantial vacancy rate within that, what we call the Western Zone of Shared Health ERS. And I know that the collaboration between government, the educational facilities, as well as Shared Health, they're working together to try and determine where those hard-to-fill areas are and how do they get people to fall in love with those communities. Is it accommodations? Is it incentives? How do they support everyone? I think there's a variety of different ideas that are being discussed. Where do we start people to then maybe go to some of the harder to fill locations? It's been an ongoing conversation. Those vacancies kind of continue to exist and continue to climb, but we also see vacancies that exist within the city of Winnipeg. So we know that through the collective bargaining process, as the minister mentioned, paramedics are seeing really great wages and really great benefits to working outside of the city of Winnipeg, which is then allowing them to enjoy the profession, to do that work, fall in love with those communities and the care that they're able to provide Manitobans. And I think all of this room full of paramedics, if we had a time machine, we would use it, but we don't. And so those vacancies are extensive. We are looking at numerous vacancies in the province, but with a little more time, eventually all of these bright-eyed paramedics will be out there supporting the existing paramedics who are working very hard to maintain the services in all parts of rural Manitoba, but particularly in that west zone of Manitoba.
Thank you. And I just have one follow-up question. How many more paramedics are needed in the Brandon and Westman area?
I would like to say every single paramedic learner in this room, you're welcome. You're welcome to the Westman. We could use each and every one of them. We can get you an exact number on that, Tessa, but to Rebecca's point, we're working directly with municipalities. We're working with community health action committees. We're working with Shared Health, with RRC. We're making sure that we are taking a pretty targeted approach so that we know exactly where paramedics are most needed, and we're getting those opportunities right in the hands of folks as early as possible. So we can get you some more specific details offline, but I can tell you I was just in the Westman, had a great conversation with community out that way, and we're working together to find some really creative ways to make sure that we're building up capacity as quickly as we can.
Thank you, Minister. That's everything from Zoom. Back to the room.
Alors, juste pour finir en français, nous sommes très, très contents puis très fiers d'accueillir tous les étudiants ici et c'est une prochaine étape pour promouvoir le système de santé dans Manitoba. Merci beaucoup.